record. There you go. All right. Well, good morning, everybody, and welcome to our combined integrative healthcare and family medicine grand rounds. And it's with gratitude that I want to acknowledge that this is possible due to the endowed Mann Integrative Lecture Series. And just so you know a little bit about that, I know I introduce it each time, but we have new people each time. Laura Mann was a nurse midwife, and she was diagnosed with stage 4 breast cancer. When she had that diagnosis, she integrated Western medicine with complementary and alternative medical therapies. Despite her untimely death, Laura's vision is alive through the endowed Laura Mann Integrative Healthcare Lecture Series. This series brings distinguished leaders to the University of Vermont to share their best practices, research, and innovations in integrative health and medicine. And we are so lucky that we do these presentations with our family medicine grand rounds. I want to introduce the speaker, but before that, I'm going to let Kara give a little announcement about the Integrative Healthcare Conference that's coming up.
Thank you so much, Dr. Calkins. Hi, everybody. I'm Kara Feldman-Hunt, and I manage UVM Integrative Health. And I just wanted to remind everybody to register for the Integrative Pain Management Conference coming up on May 7th. I'm going to put our link in the chat, so I hope you'll all register. And thanks for joining us today.
All right, so this morning, our speaker is Dr. Jeffrey Geller. He has been practicing and innovating healthcare in the Lawrence, Massachusetts area since 1996. He's known for innovating group medical visits, yay, as treatment for loneliness that could be used to provide healthcare to the poor. He has numerous awards and publications. He was running the largest group medical visit program in the country, not only reducing loneliness, but providing services to overcome barriers to health and to provide integrative medicine. He helped found and was president of the nonprofit Integrative Medicine for the Underserved, IM4US, and he has been awarded the Massachusetts Academy of Family Physicians 2020 Family Physician of the Year Award. Without further ado, welcome, Dr. Geller. Thank you so much for coming to Grand Rounds this morning.
Yeah, thanks for having me. It's nice to see all your faces. If you want to put your screen up, I'm a fan of that. But if you're eating breakfast or doing something on the side, multitasking, that's okay as well. My life was virtual before virtual happened, so we had a head start on it. But today I'm going to tell you a lot about what we did and now what we're doing, given that the pandemic has happened. Most of my work is virtual, and I do see people in groups. So seeing you like this is like a day at work for me, except for I'll be teaching, so it'll be a little more didactic. I won't be facilitating groups. Oh, I see everyone's face there. If I see your face, 5 means you really agree with something, and a fist means you hate it. So I love ice cream. So if I said, how much you like ice cream, I'd give a 5. Right. Would it be okay if we have fun today? This would be like, yeah, it would be okay. This is like, no, no fun today. Okay, I'm seeing a lot of fun. All right, so I guess we'll have fun. I'm going to share some slides. And because this is a fairly large group, I can see you all. If you could chat any questions, and then Cara or Elise, if one of you can give me the feedback, I'm happy to stop and answer questions along the way so that we can be more interactive. Okay, so integrated primary care in an underserved community during a pandemic. The title would get longer if the world got more horrible. So I'm Jeff Geller. I actually work in private practice in an underserved community. I call it private practice for the underserved. I worked at a community health center for 25 years. And then 2 years ago, about 6 months before the pandemic, I got a Taekwondo studio and had a new vision for my groups. I wanted to take care of all my patients using a group visit model because I just think it is so powerful. And I'll share with you how that was going and then what we've been doing since. My focus will be on the integrated medicine today and the integrative medicine, though we do groups that aren't integrative either for diabetes and hypertension and things like that as well. So today you're going to see different types of group medical visits. Did you know there were different types of group medical visits? Maybe you didn't. You'll see the evidence that supports group visits. In fact, it's pretty overwhelming. Whenever you do something in a group, there seems to be some added benefit, minding the introverts, minding the people who are very empowered already. And then we'll introduce you to some of the logistics, especially given COVID. I think it would be a good idea for you guys to see how we're dealing with that and having our new normal. Okay, so let me tell you about the Integrated Center for Group Medical Visits. So this is the nonprofit within my for-profit practice. It provides the services that people can't otherwise afford. So there's a lot of things in healthcare, and I work in Lawrence, which is the poorest community in Massachusetts. Sometimes it fights with Holyoke and other communities for that dubious honor. Things like a massage, things like acupuncture, things like osteopathic manipulation, though that's sometimes covered, aren't covered for people who are poor. And so if you're wealthy and you have back pain, you might see a chiropractor, might do different things. You might join a yoga class. But if you're poor, you don't have access to those things. And so one of my missions was to find ways to get people access to what we called integrative medicine 25 years ago. Now isn't so integrated, exercise, healthy food, maybe some of you remember when that was alternative. Thank God we're changing on those things, but really to get people good care. The primary care office that I do is called Kronos Health, and I work with Scott Early. You might know him, so I'm dropping his name. But our goal there is to produce high quality care by having longer visits with patients. So we spend 30 to 60 minutes with patients as opposed to the 15-minute appointments that we often see in the community health center setting that I was in. And in the community health center, I did fairly well, gentle pushes. You see your patient, you move them along as much as you can. You hope you can make them feel cared for. Try and address that loneliness, which isn't billable, right? And so what we're doing is we're taking these longer visits and combining them with the group visit model to take care of people who need quicker visits and quicker care, or need support or training, or need to overcome some of the barriers. It also allows us to offer services such as acupuncture, exercise, massage, and yoga. So like all communities, there are barriers to health, particularly in Lawrence. The social determinants of health really dominate a lot of what someone's health expectancy can be. There are very few integrative and integrated services in our community because if you're an acupuncturist, you can't make a living charging $20 a visit or $10 a visit, which is what our patients could afford. There's also a lack of sufficient mental health support in our community. I got into this to treat loneliness, and groups are just a fantastic way at reducing loneliness. Even though I'm not formally counseling, just the act of having a group can support mental health. And then I mentioned Kronos Health and the group medical visits. So let's get started here. We are an integrated center. I don't use the word integrative because, as I mentioned, some of the things that we offer now, so we have a psychiatrist and a psychologist, and we have a chiropractor. Some of those things aren't considered integrative anymore. They're considered integrated. Exercise classes. Also, as I was named the Physician of the Year last year, a very curious thing has happened where people will choose me as their physician from an affluent community saying, I want alternative medicine and I want the Physician of the Year, not knowing that I want it for my work on taking care of poor people mainly. So now I actually am integrating a community because we have affluent and non-affluent people sharing a space. So anyway, and then we're hoping to have national impact by doing this model. We think we're the only one with this model currently. And if it's a success, we'll share it with everyone. So we're doing research as well. So here's the empty space, tons of potential. I wonder if you guys have empty spaces near you these days. So what are group medical visits for those of you new? Normally you see a patient one at a time. In my own community health center, we had 15-minute visits, literally. So this would be 9 patients. This would be 2 hours and 15 minutes to see these 9 patients. And each of them would get, I believe, on average, 5 minutes of quality time, right? Other than the documentation, what have you. In a group visit, you can spend an hour and 15 minutes with 10, 20 people all at once, and they can have high quality interaction the whole time. They don't have to learn just from the doctor. They can learn from each other. They can get support from each other. And really, the reason I do groups is because I believe the loneliness is the biggest part of suffering. And you know, in our community, I can tell people to eat the healthiest food, but there are barriers to buying it. But if they feel like they're not alone, there's a much greater health benefit to that. Right? All right. When I went to my private practice, I didn't start from scratch. I moved about a half mile down the street from where I worked before. And so most of my staff came with me and almost all of my patients came with me. So that was a really beautiful thing. I had to do some promotion. Oh, I was on a billboard. Have any of you ever been on a billboard? Very awkward. It was not my choice. It was my partner's decision. I was also on local radio, things like that. I was in January already telling people, be careful of this virus. It's very, very scary. And I remember the co-host saying, it can't be that bad. And they've replayed that episode a couple times. All right. Prior to COVID, this is the layout of the space we used. You know, lots of doors, big contiguous space. If you were designing a group visit program from scratch and you wanted to have 50 group visits a week, which is what we had, you'd want a space like this. It has partitions. Give me a thumb up if you can see my cursor. I'm not sure if you can see my cursor. Okay, thanks, Scott. You don't look like Scott. All right, so, you know, we have partitions. So you can picture if we have a children's group in here and we're bringing in a Suboxone group of some rough guys, we can have the rough guys here, we can have a partition, we can get the kids out. You know, we don't have to have Corey checks of all the participants in our groups, a place for a medical assistant, a reception, and the physician to be. But really, this is the location that we've been at lately. This look familiar to anybody? This look familiar to everybody? This is our Let's Get Moving group. This is one of the first groups. This group's been together for over a year now. And, you know, really shows the power that you can do things. And they volunteered. So you'll be seeing stuff from this particular group as my demonstration group today. It's called the Let's Get Moving group. Most of these people are homebound. And so COVID has actually allowed them to have access to exercise that they didn't have before. So I know we hear a lot of negative things about this new world, but hasn't been too negative. This is our setup. So those of you interested in doing group visits, our PSR and our medical assistant are much more than that. I've been working with them for 13, 15 years. And you can see how they're working in the office. And in fact, we all sit together in a way that we can communicate. We've been vaccinated now, so the masks aren't as necessary, but we still use them often. And you'll see me whispering to Crystal or Marisol, hey, can you register this patient? I'm worried about such and such. Can you see where so-and-so is, right? So we can actually communicate in real time. And we can also communicate through the Zoom that we're having. April 5th, I believe that's next week. We are starting a new, we've been building this space since pre-pandemic because we had this idea for a hula group since pre-pandemic. Hula group, that's for our white patients who like hula hoops and they go to the hula group. Home option or live attendance. So this is what I think the future of everything is. I think some people are going to be at home from now on, and I think some people will want to come into the office. I work in an underserved community. I have many patients here. I'll look directly at you guys. I have many patients who do not have access to technology. And so they come into the office. And one of the beauties of being in private practice for the underserved is we didn't close during the pandemic. We were one of the few places actually that was still seeing people who needed to be seen. And with the technology barrier, that meant that a lot of patients who had questions and concerns were locked out. So this new space will allow 20 participants to come spaced at 6-foot intervals. We need to think about whether we want to go to 3-foot intervals. I'm not sure. You see, we have a large screen, like an extremely large screen, where we could have 25 people roughly the size of their head in the room with us. We have cameras in various locations. We have speakers and microphones throughout the space. The space can be divided into 2 spaces, not 3, because we're a much smaller practice. When I was at the community health center, we took care of 65,000 patients. And in private practice, I'm taking care of about 7. So didn't feel I needed 3 rooms. But the same principles, people can come in or they can be at home and they can be included in your group. We had functional medicine groups. Any of you interested or aware of functional medicine? Yeah, I simplify it in my community. It really is just about antecedents, which means like, let's really get at the root cause of why this is happening and try and address that. Sleep, eat, exercise. You know, we don't do some of the higher level hair analysis, and a lot of our patients can't afford supplements. So we really have a watered down version, but this is Adolfo. It's about finding ways to manage the pain, not to eliminate it. I found out about many new things that I had never heard of in the group. These guys recommend things like chanting, meditation, and weird foods. I've been to physical therapy and many other doctors, but no one had ever bothered to examine me and find out about my life, which isn't true at all. I think everyone used to examine him, but no one found out about his life, right? So, so that's the power of group. If you're starting a group,
we did just get a question in the chat. What's a PSR?
Oh, a patient service representative, a receptionist. She's kind of more like a receptionist group coordinator. You know, it's kind of amazing how, you know, we'll get into this later, what you need for a group. But, you know, some of our patients are here just to see Crystal. Some come to see me. Some come to see Marisol. Some come to see each other, you know, just like you would with any of your friends. So anyway, so what does your community need? We do trainings for group visits. We think the larger community needs that. This community needs acupuncture, so we provide that. Anyway, there are many barriers to good health in underserved and poor communities. I won't get into this in too much depth today because you've probably been hearing about this, but you know, the economical one really provides less access to technology. So that's one of the big issues you have to deal with. The social aspects, you know, role models, internal stereotypes. You know, most of the instructors we get for our exercise program are selected by the participants, and they generally choose people who are culturally competent. What are the physical barriers to health? Mental stress, right? And then COVID-19 is another barrier to health. There's more anxiety and fear. Though I hear the introverts might like it a little bit better. I think overall, you know, the world is more anxious and not doing as well. So, you know, what group visits offer, and I'll show you what a group visit looks like in a moment, is an efficiency of care, so improved access. So, you know, our acupuncture and our integrative services, stress reduction, mental health groups, you know, we can have 20, 30 people at a time at some of these groups. An acupuncture group, we have 8 people in an hour, right? So we're trying to provide access, more time for teaching health, overcoming some of the social barriers, social determinants of health, helping people live with chronic illness as opposed to always working on curing it, working on the loneliness and depression that can undermine health. And then, of course, patient empowerment, which is my favorite part. It's giving people the hope and really encouraging people to keep trying, right? Sometimes you can get very discouraged. Yeah. And so are there questions? I'm seeing, yeah, okay. And then health provider training, you know, so when I have students come with me and there's a diabetes group and there are 20 diabetics, The student doesn't walk away with what's their hemoglobin A1C and what is the insulin, the right insulin for this patient. They walk away really learning that, so people with diabetes have to urinate a lot, and that might make it difficult for them to travel. And, you know, and there's a lot of fatigue and they're feeling tired all the time and they can't eat everything they want, right? So you learn Medicaid, caring for others in a different way. All right, so this currently I put in red. So 6 months into our experiment, we were already offering 24 groups. I'll share with you what we're coming to currently. Sorry, it's a computer glitch. So we were offering 4 acupuncture groups, massage and osteopathic manipulation groups, just chronic pain groups, which could mean either support or even prescriptions. You know, so we do prescribe narcotics for some patients. Yoga group, Suboxone groups for people with addiction, diabetes groups, and we had physical exams done in groups also, which is really hilarious when you do it with children. Simon Says was our physical exam, you know, touch your nose, touch your toes, stick out your tongue, right? We had groups for headache, insomnia, smoking cessation, and obesity, and we used a lot of integrative approaches for all of these groups. Anyone curious what the massage group looked like? I think I have a picture coming up, but you know, basically we would sit in a circle, we might massage each other. We would talk about first just a check-in, how are you feeling, that sort of thing. But we would have different stations. So we'd have a massage therapist doing a 6-minute massage. So we could have as many as 10 people in the group, though we really preferred to have between 6 and 8. They would then go to a table which had like an electric massage unit, and people would put that on their neck. We then had a station where you could make a rice sock or a heating pad and put the heating pad on your body. You then would see the doctor, and I do osteopathic manipulation. So I would just do one adjustment, and that's what I would bill for, that one adjustment. And then that's it. You know, you kind of cycle through. You could choose other things. We might have music or aromatherapy. Part of our empowerment model is we'd always have something new, right? Maybe a singing bowl, something for people to try. And they'd rotate through, and they'd feel like they were at a spa, right? In the middle of Lawrence, having a moment where you could feel that good and connecting with other people. It was our most popular group, and we're really excited to be opening up again in April. We'll be having those groups again. Okay, and then these were groups that were coming soon. So we were going to be doing this telemedicine for homebound, some pediatric obesity groups, arthritis groups, back pain groups, groups for the hearing impaired, groups for people with attention deficit. And I was thinking mainly adults to start, and then children later, and then people with special needs. And then other programming, which we were on the verge of offering, was movie nights, potluck meals, pet-a-pet. So in an underserved community, people don't, you know, you have an apartment, you're not allowed to own a pet, and the expenses of having a pet might be too much. But what a great stress reliever for people, right? To just spend 5 minutes with a pet. So, you know, painting classes, and then we were hoping to have exercises at home virtually. These slides were made before COVID. But anyway, now we prepare for our new future. We made some adjustments to the space. Here's a television, here's a very large camera. Yeah, and so we started doing our groups virtually. Would it be okay if I stop sharing for a moment and check in? How are we doing? Everyone following along? 5 is like, we get it, we're following along. Who would like to see what a group looks like virtually these days? I'm seeing a thumb. I don't know if a thumb is 1 or if a thumb is like 5, but like, oh, okay, thanks, Maggie. All right, so I'm going to show you a little bit of a video. I'm going to try and talk over the video. All right. Oh, wow, there are 100 of you here. Thanks for having me. Okay. And just someone give me a thumb up if you can hear it. There's nothing to hear yet. Okay, great, the volume's working, great. So a lot of you might think of exercise as being an exercise instructor and people following along at home. Turns out that could feel a lot like just watching a YouTube video if not done correctly. You know, you do want to make sure that you have a great exercise instructor who's very engaging.
Ready? Joy.
Anyone else feel joy today? So she's a lot of fun, but we do things to make the groups a lot more interactive. And in fact, I like it when I see all of you on the screen. It makes me feel more connected than when I just have this picture up showing
And I'm actually gonna say one of your names, and then you're gonna do a dance, and we're gonna do it.
If you heard what Loida said, she's now going to get everyone involved. And we worked with her to find the right way to do these at
Whenever
home.
you're ready, Jean, show us what we're doing next.
So everyone goes around the circle and they lead the exercise. And so we're doing dancing. Feel free to dance along if you'd like. I really can't see any of you. Oh, except for Cara, I can see you dancing.
Awesome. And next, I'm bringing Crystal.
Yeah. Crystal is, as I mentioned, she's our receptionist, and she's actually running the group. So she's saying, Loida, why'd you call on me? So you have to make sure you work as a team.
So when you're ready, Edith, show us what we're doing. Oh. All right.
Okay, so you get the picture. We go around the circle. I'm going to zoom ahead a little bit here. You know, because we can also do meditation as a group.
Feeling your shoulders go back and even sticking out your chest just a little bit.
You can see where I'm sitting. I have Crystal right behind me, Marisol to my side. You know, we haven't talked about the billing yet, but we will in a moment. And how you pay for these programs is probably important to all of you.
And all the way to the other side.
I try and participate as much as I can.
Forward.
You know, if you're trying to reduce loneliness, being there is like
I'm gonna keep going.
step
Do
one.
this a few times.
All right, so you get a sense of what this looks like. You'll have kids playing around in the background.
Here, crack.
You'll have to teach everyone how to mute themselves, how to pin a picture, how to change their names. A lot of fun things that people do.
Let's go really slow. Be gentle with yourself.
It's okay to have families and people doing things. And then you'll see here, you see Crystal is really running the group, right? So I'm the provider of the group. I don't want to be running the group. I don't want to be breaking people into small rooms.
Let's see what
So
you
she's
got.
doing that
I
for
can
me.
see you guys.
Okay, perfect.
Move.
Yeah, my wife.
There we go.
Okay. Was that helpful? Fun? All right, now you guys are getting it. How do you communicate with 100 people at once? Your fingers, right? And we have to look at everyone's picture. Not everyone has their picture up, so they don't get to have a voice, right? So if you want to be part of the voice, okay. So I'm going to go back to our slideshow here. Okay, where were we? We provide for a new future. There we go. And so this is what our schedule is going to look like next month. Now, I have all these patients who've been begging, when can we do groups again? When can we do groups again, right? If you were starting a program, you would start with 1 or 2 groups a month or 1 or 2 groups a week, right? But you can see we've really figured out when the mornings happen, when the afternoons happen. If I'll zoom in on different parts of the schedule, but you'll see there's a hula group in the morning. That means that people can come from home, and it's for Kronos Health. That means it's any patient in the whole clinic where I work. Here it says chronic pain beginner exercise. It says community. That means anyone in Lawrence can come. You know, that's where the nonprofit comes and helps support groups. So here we have the hula group. That means people at home can be there. The massage group is not a hula group. We're limiting it to 6 patients. It's going to happen at these times, right? In the afternoon, that's when you do an exercise class for children in the afternoon. Chronic pain groups aren't the first thing you do in the day. You start and end your day with exercise groups, right? So typical morning, you start with exercise, or, you know, we do our physicals in the morning because people are fasting and they need their blood tests done, right? Hypertension groups, diabetes groups, chronic pain groups. And chronic pain groups really meet, and this particular one has exercise, but some of our pain groups have acupuncture, other things. And then in the afternoon, we have some yoga in the afternoon. We have group visits for controlled substances. You'll see this says Geller. So those are just my patients. I'm writing prescriptions for my patients who are using controlled substances, not just anyone in the community. You can't just come in and get that. Smoking cessation groups are once a month. Headache groups are once a month. What am I leaving out? I don't know. We have some real comprehensive treatment for chronic pain. We might as well call ourselves a chronic pain center, but we aren't technically. We have functional medicine. We have new groups for post-COVID. If you were to start a group from scratch, I would have you consider obesity groups, post-COVID groups, and chronic pain groups, and whatever integrated skills you have or people you have in the community to work with, consider that. So these are the motivations to do group visits. Here you can see what a massage group looks like a little bit. This is pre-COVID, obviously. So, groups provide support. They help people working together. We were talking about healthy foods for diabetes. So this is a diabetes group. And eggs, cheap, one of the best, it's very healthy. The yolks are even healthy now. So don't worry about cholesterol anymore with the yolks. I think we're kind of excited about that. However, when I said even, how do you boil an egg? It was 2 sessions figuring out the best way to boil an egg. Some people put it in the water before the water boils. Some have the water boiling, then put the egg in. Some put salt in the water. Some cover it with a lid. Which one tastes better? Which one does the shell come off better? We had, it was supposed to be just like 5 minutes. Okay, one of the things you can eat is hard-boiled eggs. But with good facilitation, it became like, I wonder really what is the best way to make a hard-boiled egg. And we walked away with pretty much the same opinions we walked in with. So, but it was a lot of fun. There's an efficiency of care. So I mentioned, one acupuncture visit in my individual clinic used to be 15 minutes, right? Because we needed that room. We needed to move people in and out. Now we can put the needles in. They can lie there for a full hour, get a longer effect, and you can take care of 8 people in an hour. Art projects. These are actually patients leading other patients. One patient who knew Reiki, one patient who would lead in Tai Chi. Here's some integrative things. You're in Vermont, maybe you have more access to herbs, things that grow wild. Here we have in our massage group, we actually have a caregiver learning how to give a massage to their partner, right? So really teaching skills so people can take care of themselves. Making rice socks in a chronic pain group. And then I mentioned teaching. I see many people with the same conditions and find they are all different. So this is kind of student comments. This is me teaching large groups of Tufts medical students. This was our last real training group at the Integrated Center before we went virtual. So group visits really, they fit into the biopsychosocial model of thinking and care. Often with an individual visit, you're working on the individual and interpersonal, so someone's self-efficacy, mindfulness, and you try and get them to the right referrals, the right consultants. In group visits, you're thinking a lot more about the larger community and the social network in the community. You're learning more about what's going on nationally. In Lawrence, we've had a lot of tragic things. We've had gas explosions, we've had fires, and people come to the group after those experiences to really collect themselves and feel connected once again. Here's some evidence-based things. You can go to our website, www.icgmv.org, for a full bibliography. So group visits increase access and the amount of time with clinicians. There's better patient satisfaction with group visits, less health service utilization, including emergency room visits and medication use. But there's better medication adherence. Curious. Health behaviors. So health-related quality of life is really the best indicator in group visits that there's improvement, and health-related quality of life improves almost in all groups. And there are just many disease-specific outcomes, obesity, diabetes, pregnancy, that really show it's superior to individual care. Groups are mostly in Massachusetts and California. I think we've influenced that a lot with the work that we've been doing. And the Integrated Center is really trying to make the whole country see red, not politically, but in terms of use of group visits. So one of the best things at group is that everyone is allowed to talk equally. They're equal doctors to people. It's a personal approach, not a medical approach. I learned a lot more information than I would in a patient visit that applied to me, and all of a sudden, everyone's better. You can help yourself and you can help others at the same time. Any questions? I noticed a couple of things flashing there. Anything I should pay attention to?
Jessica, do you want to ask your question? Or I can shout it out for you. She's asking, oh, you there, Jessica?
Sorry, I've got loud kids in the background, so if you could read it out loud for me.
Yeah, no problem. If one of your patients has more in-depth questions they want addressed by you about their personal situation, how do you balance that with the group?
Okay, so that's a perfect segue. So we're just going to keep going here. I'm going to teach you how we do that. So this is the anatomy of a group visit. We usually have a check-in, and we have between 6 and 40 participants. You know, an exercise group, that's where, now that it's virtual, I guess we could have 100 participants, people at home participating, but there's usually some sort of a check-in. If it's a large group, on Zoom, I break them into small groups, but when I was in person, I was breaking them into small groups as well. You know, what's a rose and a thorn, one thing that's going well for you this week, one thing you think you could do better, right? And people talk. Then we have some sort of an activity. So an exercise class is a great example. So 30 minutes of exercise, or, you know, massage or acupuncture. And then we do billing, and then we close the group. All right. Let me show you where we talk to patients individually. So this is a schematic of our model. And this is, in some groups, you see all the patients and you bill them for every visit. So when I have a Suboxone group, we actually have oral testing. They sit in a circle, we talk, we collect the samples. I meet with them individually, give them their Suboxone, unless there's a real problem. And then I bill them for that work. So we can have between 4 and 12 people in an hour for a Suboxone group. Our exercise group, if we have 100 people, there's no way I could see all of them, no way. So instead we say, who needs to see the doctor today? Or maybe who's a new patient to the group. And that way I meet them, and we try and see about 6 patients an hour. So we have very high productivity in these programs. But anyway, here's a group, and we have our group check-in. You'll notice some of these people here are purple. We have the light blue people and the purple people. There's some sort of a coordinator. That could be Crystal. That could be an exercise instructor. And then there's me, the physician. We welcome new people. Disinhibition activity just means we make people feel comfortable. And then we talk about some topics for discussion. So the group starts, and in today's group, we're doing an activity called spinning. So you see the people are spinning. The purple people are the people who asked for a visit, right? It's a chronic pain group. I need a refill today. And so of the 20 people here, 5 of them are going to be seen by the doctor. While the group is going on and they're doing their spinning, they meet with the medical assistant. After they meet with the medical assistant, they have personal time with the physician. You don't need to do this in group visits for billing. I do it because I'm trying to create a safe space for everyone. If they need to talk to me individually, it's there. You know, especially for someone who might be more introverted, who doesn't want to say what's going on in front of everyone in the group. These visits are short because people came to do the exercise. People came to get their massage, right? They don't want to waste that whole time on me, right? So they tend to be succinct. They tell me what they're thinking, and I do an empowerment-based interview. They then return to the group. Empowerment-based interview, I say, what's one thing you think you could do to be healthier? Pretty simple. So what leads to a successful program? A comfortable environment, a good experience. A good experience doesn't mean it has to be a happy experience. If you're a facilitator, it doesn't mean you have to entertain people. In fact, the best facilitators are introverted, I find, where they let the group talk, sit on their hands. If you're an extroverted person, you could also be an excellent facilitator, but you got to learn how to, you know, hey, I have a great idea. Let's all stop eating rice. You know, hey, let's let the group come up with the ideas. Clear goals, expectations, why are we here, right? And then you see the asterisks next to consistency. That's the key to the groups. I actually am researching something called the group inclusion effect, which is a bit like the placebo effect, except for we know why it's happening. So it turns out whenever you bring people together in a group, the outcomes are slightly better than when you see people individually. So if they said we did a trial of vaccines and we brought 20 people in together at a time and we gave them all the vaccine versus we had one person coming in getting a vaccine at a time, I bet this is crazy, the outcomes would be better. People would say it didn't hurt as much, it was better received, they had more information from the group. So consistency makes this all possible. So if you have the same receptionist and you have the same provider and the group's on the same time of day and the same day each week in the same place, you know, you get it. The more consistency you have, the better chance, and the same participants. You know, you want the same group of people who are getting a massage to keep coming every week or month or whatever, you know, you're doing, so that they get to know each other. And that reduces the loneliness, and that's the secret sauce. So like I said, some people like me, some people like my receptionist, but most people like the other people in the group. Okay, financial stability, obvious, and then accessibility. So, but this is what makes people attend your group is, are the groups meaningful? You know, are they relevant? Are they fulfilling? And they become meaningful when people share a little bit about themselves, right? And they learn about others. It doesn't have to be done in the big space of the group. But if I said to everyone, hey, let's break into a small group, and what's one thing that's really bothering you about healthcare today? You'd all be able to complain and you'd hear what other people are complaining about. Okay, groups also are successful if they provide value. So, you know, services that aren't otherwise available. So acupuncture, hypnosis, we haven't been doing too many hypnosis groups these days. Education, integrative medicine is extremely valuable to people. You'll notice that straight up education, not so much. You know, especially, so there are kind of two groups of people, those who are empowered, and if they want information, where do they go? The internet, right? So they go, oh, I already know the diet for diabetes. Oh, I already know these things. You know, I've looked it up myself. And the groups who aren't empowered aren't necessarily, the biggest barrier isn't education. It's usually like, how am I going to get healthy food? You know, okay, I know I need it, but how am I going to overcome these barriers? So often, okay, so just think about value in your community. It's probably different than my community. And then fun, you know, groups need to be fun. It's, like I said, it's perfectly okay to talk about sad, depressing topics. But at the end of the day, you know, people don't want to go to a depression group and hear other depressed people talk about their depression. I don't think. Has that been studied? Anyone know? You want to do enough of that so that people feel supported. And then they want to, you know, chuckle about the common experience of whatever they're going through. So that's where facilitation comes into play. And that's what we spend a lot of our time in our training, is training people to facilitate the groups so that they can be meaningful and fun and have value for people. A good facilitator will keep the shy and the introverted people engaged. You know, extroverts love group visits. No need to worry about the extroverts. And by introverts, I just mean someone who's quiet in that moment. Much harder to gauge with Zoom. You know, wish I could give you some advice, but sometimes people just aren't saying something because they have a noisy background. You know, sometimes people honestly don't feel comfortable in that space, you know, and you don't really know. So we offer trainings. If you check our website, we have a training on facilitation skills in 2 weeks. So it would be a good time to join if you're interested in that. Group visits are really taking off because of the opioid crisis. How am I doing on time? Are we doing okay still? I want to make sure there's time at the end.
Yes, well, 15 minutes.
Okay, all right, I'll wrap this up then. So the opioid crisis, that was our big pandemic, wasn't it, before the pandemic? But the CDC, really for the first time endorsed non-pharmacologic treatment of pain and said this is a priority over the pharmacologic treatment of pain. And they really put a lot of pressure on practices to offer non-pharmacologic treatments. And it turns out that most of the non-pharmacologic treatments, there's physical therapy, there's exercise, there's psychotherapy, and most of the other stuff is complementary medicine, yoga, stretching, Tai Chi, different types of exercise, massage, acupuncture. And the Joint Commission actually made it scorable now that you need to offer non-pharmacologic strategies, including acupuncture, chiropractic, osteopathic manipulation, massage therapy, and physical therapy, relaxation therapy, and cognitive behavioral therapy to get full scoring on your Joint Commission scoring. I don't know what's going on with COVID personally, but and anyway, group medical visits really shine as a way of treating chronic pain. And so it might be a good first group to start with. Emotions win. So people will forget what you said, people will forget what you did, but they'll never forget how you made them feel. And group visits are great at making people feel included, special, important, and great, right? So they're going to have a good experience. I'm going to leave you with one particularly amazing group. Not all of my groups are amazing, right? You'll find that some groups don't work out, some work out great, some grow. I've had some groups that have been going on for 24 years, right? So they run themselves. But one of our Suboxone groups, we had a member of the group who had been in prison. He'd just gotten out of prison and he had been clean. I know we don't use the word clean and dirty anymore, but that's the language that this group was using. And he was going to see his 6-year-old son for the first time in a year or two. And he simply said, I wish there was some book that I could read to my son that would that kind of explain the Suboxone and why I haven't been there. It's not that I don't love him, right? So we spent 18 months writing this book. Daddy used to be sick and he's much better now. And through this book, we explored different topics. There was a time when he wasn't there. I used to think he didn't care. The book doesn't entirely rhyme, but it tries to. And each month, we would get together weekly and discuss this book. And we had 12 participants in this Suboxone group. And over that year and a half, 11 of them were clean for that whole time. We hardly talked about Suboxone at all. We would get together and we would talk about the book. And hey, I have another chapter. And I had ADD in school. Oh my God, I had ADD. I had trouble in school. I was bullied. Oh my God, everyone was bullied in this group, right? They found a lot of common things in a lot of pages. This is my favorite page. Daddy sees the doctor. Wow, the doctor has a ponytail. I don't know if you can see. I have a ponytail, so proud of that. He's so much better now. So when you think about group visits, you're really thinking about healing in a much bigger way, healing in the context of a community, really getting to know your patients a lot better. I know my patients in my group that I see frequently. I get to see them exercising, walking around, talking with others. I get to say, I know why this person's lonely. I got to teach them how to make friends, right? Or, this person actually says life's terrible, but look at them. They really function very well. So if you're interested in training and group medical visits, like I said, we have a training going on right now. These are the emails. You can talk to me directly. Reach out to Kara or Kara if you need my information. We're really excited. September 17th, we're hosting our first ever conference dedicated to group medical visits called Together We Heal, Resiliency and Adaptations of Group Medical Visits in a Pandemic World. And this is a true group visit conference, so it'll be inspiring. Hopefully you'll see a lot of different models of group visits. But more importantly, we'll all work together to figure out, how do you get billing specifically for group visits? It's a topic that's always not chosen. What does true consent mean? Like right now, this is confidential, right? Or is there someone standing just to the right of me? You know, what's really going on here? So anyway, we're really excited to explore all that. And you can do it too. We're not sure when we'll have live classes again in group visit facilitation, but right now we're doing them virtually. Our next one will probably be next October. So if you don't hook on for this one that's going on now, you can do it next October. All right, so I'd love to leave you with a poem written by one of my patients. But as I get that ready, I wonder, are there any questions for me?
Maggie has a question. You want to ask Maggie?
Yes, hi. It's great. I love this work. And but one thing went through my head when you were talking about like people having a question or a concern, an individual concern in the group context of an exercise class. Have you had any luck reaching into the PT community to try to get that piece of advice or that piece of expertise in there, or does that not work?
Tell me, what's the PT community?
The physical therapist community.
Oh yeah, no, we have had physical therapists work with us in our group, mainly for our chronic pain group, and it was like one of our stations. You would spend 5 minutes talking to someone, and that 5 minutes isn't a lot, but over time, you know, where they say, hey, I noticed you're walking funny. Hey, you know, you might want to try this exercise. You know, each thing becomes an added expense too, you know, so we have a chiropractor currently working in our office who is very skilled at teaching exercises and things like that. So we kind of work with him currently in our groups, but anything goes, you know, like groups are extremely flexible. Centering Healthcare has one very specific model, but really you can really do any type of model you'd like.
Thanks.
That's a good question. All right, let me show you this video because I think it captures our group visit. This is someone from our functional medicine group. Let me see, share screen, see if I can pull it up. His name is Rich. He wants to be famous. I tell him this is the best poem I've ever heard. Hey, Rich. So how long have you been in the group? Can you hear okay?
Oh, I would say about 2.5 years.
Okay, has anything changed for you over that time?
Yeah, I've gotten healthier. I don't know what's doing it, but I do feel healthier, and my numbers are better.
Okay. Can you share the poem that you wrote as an activity in our group?
Sure.
Okay.
Okay, the name of it is In Search of Health by Rich Hersher, that's me. Plentiful water we must drink, from where I dare say we must think. Tap, bottled, bottle tap, or boil bottled. I've yet to take a single sip, and yet my mind's already boggled. It seems the experts can't agree, which brings us to omega-3. Wild tuna swimming free, once upon my plate will be a rich source of omega-3. But what about the mercury? Eat plenty of greens, seems safe to say, but what about the awful spray? Organic seems the only way, but hey, who's got the bread to pay? Though my heart grows ever weary on this quest for inner health, which wisdom taught me at this age is paramount to wealth. I trust in you, this group around me, that somehow in this world has found me. I trust in you, I trust the group will see me through. The end.
Thank you. So yeah, I'm seeing 5s, right? Best poem ever. I love that because it's like, you know, Dr. Geller, in this group, we've learned about all these things, but I can't actually do them. But boy, do I feel better. And how am I in this? How have I found all these people, these crazy people who are going through this with me? So just know that the power of the group isn't always in solving people's problems. It's in the bringing people together, which is what I think is this grant, this program, celebrating a person in your community is bringing you all together, right? So kudos. And I don't know if there are any other questions. I'm happy to hang around. Enjoy the snowy weather up there. I have sunshine, so I'll take advantage of that.
I have a question, and I think I ask this every time to people doing group medical visits, but I find that the physicians who want to do group medical visits want to be part of the group, and they don't want to be the one pulling the patients out because then they're not a part of the group. And so I wonder if you could speak to that a little bit.
Yeah, you can't be part of the group the whole time. And if you're really facilitating a group well, they shouldn't rely on you. They need to rely on each other. And so, I spend the first 10 minutes of the group facilitating. And then if I say, okay, break into small groups and talk to one another, I can go see some patients individually and then bring them back and say, who had a particularly meaningful conversation, right? And, or you can say, okay, today we want to help Joe wants to visit his family in New York, but he has diabetes and he has to urinate every hour. Let's spend this hour figuring out how we can get Joe to see his family in New York. And it can become quite a meaningful time. And then I'm there to see people individually. I am there to make sure the group goes well. If you have an economy of scale, so, you see how I'm not just opening one group at a time. I'm like, okay, well, if I'm going to have my staff and people there and pay for it, 6 patients an hour only works if you do it in consecutive hours. If you do 6 patients in an hour and then take an hour off to regroup, or if you do 6 patients and you have a 2-hour long group, the finances won't necessarily work for you. And so, we try and have large groups. Because if you're looking to make a friend, have someone find a friend, not with you, the doctor, but with each other, if there's only 2 people there, the chances of them being friends is unlikely. We also, you've noticed, we're getting away from offering groups for disease. So I have asthma, but I don't choose my friends based on whether they have asthma. But someone could say, oh, do you want to do exercise? I would probably choose the rigorous exercise group. I can't bend at all. I'm not a yoga person, right? And then the amazing Crystal and Marisol, who've been working with me for years, they put people in groups. So when someone calls, they find out it's a young woman. We have a group with young, energetic women. They'll try and put them there first. Oh, you're a slightly older person with these interests. I'm going to put you there, right? So we kind of have these matchmakers working for us too. Long answer to a short question, sorry.
Hi, this is Jessica. Do you have a good resource that you've compiled or have online for people who might be interested in starting group visits at their practice?
Yeah, we do. So if you go to our website, which is icgmv.org, maybe I'll type that in the chat here. Typing. cgmv.org. If you go to our website, we have 2 manuals, one on starting chronic pain groups and one on starting pediatric obesity groups. We are a true nonprofit. We have a training going on right now. We've never turned anyone away for financial reasons. And our prices are sometimes $50. The current training, I think, is $150. Basically, we only have to pay for CME and our Zoom account, so as we do things virtually, we try and keep things very affordable. We try and get donors and other people to support our mission. So, I would recommend you just give us a call and we'll get some training for you. We are going to have a little bit of a window without trainings, specifically as we get ready for our conference. And several people from Vermont can vouch for the training. Thank you for that comment.
Have you ever run groups where there's a graduation? And then, well, I guess maybe since you're doing all groups, you don't need to consider that. But that's something that I'm getting ready to begin, is a group that will run for 8 weeks and focus on sort of like more of the pillars of lifestyle medicine, not a lot of didactic, a lot of support, good nutrition and culinary built into it, culinary medicine built in. But then we were logistically, I think, going to end up graduating people after the 8 sessions and then start a new group, which is a lot different, I think, than what you're doing. But I love how you're doing as well.
So graduation has a lot of different terms to it. Paula Gardner is the queen of graduation ceremonies. She's my partner in crime. And she runs a lot of 6-week programs, 8-week programs, and giving someone a certificate really makes them feel fantastic. You know, like, oh, I've mastered cooking and diabetes or nutrition. Most of our patients who graduate, though, just move to different groups and different spaces. So if we have someone who starts with us, they're out of shape, they may have had a heart attack, they're doing exercise. You know, our exercise groups are just once or twice a week. We aren't the most rigorous. You know, we're not trying to be, give me 10 more, you call that working out, right? Some people will then join Planet Fitness and they'll go there and do their exercise. And they'll just stop in on the group when they need refills of medicines or something every 3 months. So they've kind of graduated. In our diabetes group, people will learn everything that we can teach them in the group. You know, so even though we don't have an official end, they're like, oh, I've heard Dr. Geller talk about Trulicity now for 100 years, right? So then they might start coming to the regular, you know, I'll say, well, you can go to the regular exercise groups. You don't need to know about diabetes anymore. I agree, you know everything. Or you can help me teach others, right? So some people never leave because they like that position of helping others.
Thank you.
So I'm happy to hang on. It looks like the time is over. Though what does time mean these days? I don't even know. So if anyone has specific questions, I'm willing to hang on for a little bit longer. But thanks for having me, and enjoy your days, your weeks. You know, think about your community, think about what patients need more community, and maybe you can start some of these groups together.
Thank you so much, Dr. Geller.